Today's ICD-10 quick coding tip focuses on what you need to know about coding medical conditions due to substance use, abuse, and dependence. My name is Claire and I'm an inpatient coding auditor. In my quick tips and tricks videos, you'll discover valuable insights to help sharpen your medical coding skills and code with confidence. If that sounds like something that would be helpful to you, please consider hitting that subscribe button so that you can be notified whenever I release new content. The coding of medical conditions resulting from substance use, abuse, and dependence has been a frequent area of confusion for many coders. Many coders mistakenly assign a code for substance-induced disorder when a medical condition is documented as substance-related. However, it's important to understand that medical conditions resulting from substance use, abuse, and dependence are not classified as substance-induced disorders in ICD-10. Instead, it's necessary to assign the diagnosis code for the specific medical condition along with the appropriate code for the substance abuse or dependence. For instance, as explained in the Guideline, in the case of alcoholic pancreatitis due to alcohol dependence, assign the code for alcohol-induced acute pancreatitis along with F1020 alcohol dependence uncomplicated. It would not be appropriate to assign code F10288 alcohol dependence with other alcohol-induced disorder. Let's take a look at a couple more examples. In this scenario, the patient is admitted with abdominal pain. As the physician gathers more information, the patient reveals that they've been consuming multiple glasses of wine every night since losing their job 6 months ago. Subsequently, the patient is diagnosed with alcohol-related gastritis as well as alcohol abuse. In this case, the code for alcoholic gastritis is assigned along with the code for uncomplicated alcohol abuse. This is because gastritis is a medical condition, and while it's necessary to assign a code for the alcohol abuse, it should be classified as uncomplicated since the development of gastritis resulting from it does not fall under the classification of a substance-related disorder in ICD-10. In this next scenario, the patient who has a long history of alcohol dependence presents with nausea and vomiting and is diagnosed with alcoholic ketoacidosis. In this case, the code for ketoacidosis is assigned along with the code for uncomplicated alcohol dependence. This is because ketoacidosis is a medical condition, and while it's necessary to assign a code for the alcohol dependence, it should be classified as uncomplicated because the development of ketoacidosis resulting from alcohol dependence does not fall under the classification of a substance-related disorder in ICD-10. Let's take a look at a couple more examples that specifically pertain to drug-related conditions as opposed to alcohol-related ones. Both of the following examples come from coding clinic advice. In this example, the provider diagnosed chronic methamphetamine-induced cardiomyopathy. Although the patient had a history of methamphetamine abuse in the past, he is no longer abusing the drug and is currently in remission. According to the coding clinic, the appropriate codes to assign in this scenario are the codes for cardiomyopathy due to drug and external agent and the code for other stimulant abuse in remission as an additional diagnosis code. Since the provider has documented history of methamphetamine abuse currently in remission. No code for substance-induced disorder is assigned in this case, as the condition is a chronic medical condition that developed as a result of a long-term drug abuse. Therefore, it does not fall under the classification of a substance-related disorder in ICD-10. In this last example, the patient has been experiencing nausea and vomiting for a period of 4 to 5 days. The healthcare provider has diagnosed the patient with Cannabinoid hyperemesis syndrome, but has not specified whether the patient uses, abuses, or is dependent on cannabis. According to the coding clinic, the appropriate codes to assign in this scenario would be the code for nausea with vomiting unspecified, along with the relevant uncomplicated code from category F12 cannabis-related disorders. The coding clinic further advises that when the specific pattern of substance use, such as dependence, abuse, or use, is not clearly documented, it's necessary to query the physician for clarification. For instance, if the query confirms cannabis abuse, the code for cannabis abuse uncomplicated should be assigned. This is because cannabinoid hyperemesis syndrome is a medical condition caused by the heavy chronic marijuana use, and it does not fall under the classification of a substance-related disorder in ICD-10. So that's it for today's quick tip. I really hope that this video was helpful for you. If it was, please give it a thumbs up, and if there's any topics that you'd like me to cover in the future, just leave a comment below and I'll add them to my list. Thanks for watching, and until next time, happy coding.